Ready for a deep dive? Let's talk teeth. We're exploring dental anatomy and morphology today.
Fascinating stuff.
It really is. I mean, we use our teeth every day, but how often do we really think about what's going on in there?
Right. This book really gets into the nitty-gritty.
Like what?
Well, for example, did you know that the enamel on our teeth is harder than steel?
No way. Really?
Yeah,
Uh,
it's true. And it makes sense when you think about it. Our ancestors needed super strong teeth.
to tear through tough foods and stuff.
Exactly.
Right.
Evolution at its finest. Speaking of evolution, remember how we have baby teeth and then adult teeth?
Yeah.
Well, humans actually have two sets of teeth in our lifetime. It's fascinating.
The tooth fairy loves that fact.
Haha, very true. But in all seriousness, those baby teeth are more important than we realize.
Oh, totally. They're like placeholders for our adult teeth, right?
Yeah. They help guide those permanent teeth into place.
It's like they're setting the stage.
Exactly. And those baby teeth usually start coming in around 6 months of age.
So cute. When they get that first little tooth,
And then they have a full set by the time they're about 2.
then it's time for round two.
Yeah?
Right? The permanent teeth.
Yep. Those start emerging around 6 years old
And they keep coming.
until about 21.
Wow. I had no idea it took that long.
Yeah, it's a long process.
It makes you appreciate how complex our teeth really are.
That's what this book really highlights. It talks about all the different types of teeth we have. Incisors, canines, premolars, molars.
It's like a whole set of tools in our mouth.
Exactly. And each one has a specific job to do when it comes to chewing.
So like a toolbox analogy. I like that. What about incisors? What do they do?
Well, think about taking a bite of an apple.
Okay.
Those front teeth you use to make the initial cut,
Yeah.
those are your incisors. They're like tiny chisels,
Wow.
perfectly shaped for biting and cutting. They also help us articulate words
Really?
and support our lips.
So they help us speak clearly.
They do.
Wow, I never knew that.
It's amazing.
It is. Okay, so we've got our incisors. Those are important. What about those pointy teeth next to them? Those are the canines, I think.
Exactly. Those are the ones people compare to fangs.
Uh-huh. I know, right? They're kind of scary looking when you're little.
They are. But they're essential for tearing and ripping food. Imagine trying to eat a steak without them.
Oh, man, that would be tough.
Right. And their placement is really strategic.
How so?
They act as guides, making sure our teeth don't grind against each other in a bad way.
Interesting.
Yeah, it's called canine guidance. And it's one of the reasons why our jaw moves so smoothly.
So they're like the protectors of our teeth.
In a way, yes.
Yeah.
Protecting our bite, for sure. Now, behind the canines, we have the premolars.
Premolars, right? What do they do?
They're kind of like the middle child of the tooth family.
Uh-huh.
Often overlooked, but they play a crucial role.
Which is?
They help crush and grind food.
Okay, so they're kind of like the in-betweeners
Yeah.
between the canines and the molars.
Exactly.
Interesting.
What else? Oh, and here's a fun fact. You only get premolars in your adult set of teeth.
Yeah.
Babies don't have them.
Really? Huh. Makes sense, I guess.
Yeah, they don't need that extra crushing power.
Not yet.
Right. And finally, we reach the back of the mouth.
The molars.
Yes, the heavy lifters of the chewing world.
I've always wondered about those. They seem so mysterious.
Well, they're actually fascinating. They have those multiple cusps, those little bumps.
Right.
And those cusps help grind food into smaller pieces.
So it's easier to swallow.
Exactly. They're the MVPs of digestion.
Wow, they really are. We have so many different types of teeth, and they all work together.
It's incredible, isn't it?
It really is. So we've got all these different types of teeth working together. What else does this book tell us about our teeth?
Well, it also dives into some specifics about each individual tooth.
Okay, cool. What kind of specifics are we talking about?
For example, let's start with the maxillary central incisor.
The what?
The maxillary central incisor, that's the one right in the front and center of your upper teeth.
Oh, okay, got it. The front tooth. What about it?
Well, when you look at it from the side, it actually has a subtle shovel shape.
A shovel shape, really? I've never noticed that.
It's subtle, but it's important for biting and tearing food. And like a well-used shovel, the surface of this tooth can show wear and tear.
Okay, interesting.
The book talks about these faint ridges and grooves that can fade over time.
Huh, like they wear down?
Exactly.
Okay, cool. What else? What about the tooth next to it?
You mean the maxillary lateral incisor?
I guess so. I'm still learning all these technical terms.
No worries.
Yeah.
But yeah, the lateral incisor is a bit of a rebel. It's known for its variable shape.
What do you mean?
It can have subtle differences in its shape, and it often has a small indentation on the backside.
The backside, you mean the part that faces my tongue?
Yes, exactly. We
Yeah.
call that the lingual surface.
Lingual surface. Got it. So what about the backside?
It often has a little pit there.
A pit on my tooth. Should I be worried?
Not at all. It's perfectly normal. Just a little anatomical quirk.
Okay, good to know. Okay, so those are the incisors. What about the canines? You were saying they have long roots?
They do. Those canines are really anchored in there. They need to be strong because they take on a lot of force when we chew.
Right, because they're kind of pointy.
Exactly. They're designed for tearing and ripping. And those long roots help to distribute the force and protect the tooth.
Wow. They're like the bodyguards of our mouths.
I like that. That's a good way to put it.
Mm.
They're tough, and they're there to protect the other teeth.
Okay, cool. What about the premolars? We haven't talked about those much.
Well, the maxillary first premolar has a cool feature.
Okay, tell me more.
It often has this little hidden papillary pocket on its side.
A hidden pocket? What is that for?
It's there to protect the gum tissue between your teeth from getting pinched or irritated when you're chewing.
Wow, that's pretty amazing. Our teeth really are designed so well.
They really are.
What about the other premolar?
You mean the mandibular second premolar?
Sure.
That one's interesting because it can't seem to decide how many cusps it
The
wants.
cusps.
You know those little bumps on the biting surface of your teeth?
Oh, yeah.
Those are cusps. And the mandibular second premolar can have 2 or 3,
So it's like it has an identity crisis?
something like that. But it's all part of what makes our teeth so fascinating.
It really is.
Yeah.
Okay, let's talk about molars. Those are the ones in the very back, right?
Exactly. And they're the ones that do most of the heavy lifting when it comes to chewing.
They always feel so big and powerful.
They are. The maxillary first molar, the one that erupts around 6 years old, is actually the tooth that is most likely to develop cavities.
Oh, no. Why is that?
Well, it's exposed to sugary snacks and drinks for a longer period.
Because it comes in so early.
Exactly. Plus, it has lots of grooves and pits on its surface which can trap food,
So those grooves are good for grinding, but bad for cavities.
pretty much. But don't worry, that's why we brush and floss.
Okay, good. So what about the other molars?
Well, the mandibular first molar is a beast. It's the largest tooth in the lower jaw.
Wow. No wonder it feels like my back teeth do most of the work when I'm chewing.
They do. They need all that extra surface area for grinding.
Makes sense. And the last molar.
Mandibular second molar.
Hmm.
That one usually has 4 cusps,
Mhm.
and it's a bit smaller than its first molar sibling.
So they all work together as a team.
Absolutely. Each tooth has its role to play.
That's so cool. Wow, so we really do have an incredible set of tools in our mouths.
We do. And they all work together so seamlessly.
It's amazing. All those different shapes and sizes and those little details we talked about, like the cusps and ridges.
It's all by design. Those features are what allow our teeth to function properly.
Right. Like those cusps on the molars help with grinding.
Exactly. And those ridges on the incisors help with biting and tearing.
It's like everything has a purpose.
It does. And we've only scratched the surface of what our teeth can do. Remember how we talked about how important incisors are for clear speech?
Oh, yeah. It's amazing how much our teeth affect the way we talk.
Right. And they also play a role in our facial appearance.
It's true. I never really thought about it that way before.
It's easy to overlook the importance of our teeth.
Totally. But after this deep dive, I definitely have a new appreciation for them.
That's great to hear. That's what I was hoping for.
So what would you say is the most important takeaway for our listeners?
I think the biggest takeaway is that when you understand how your teeth work, you can take better care of them.
That makes sense.
Right.
Yeah.
Like if you know that those grooves and pits on your molars can trap food,
Yeah.
you'll be more likely to make sure you're cleaning them properly.
And if you know that your canines are crucial for tearing food,
You might think twice about using them to open a bag of chips.
guilty as charged. But seriously, this has been eye-opening.
I'm glad to hear it.
So what's the final word? Why should we care about our teeth?
Our teeth are these little powerhouses that help us eat, speak, and smile. They're essential for our overall health and well-being.
Well said. And on that note, I think we've come to the end of our deep dive.
I agree. It's been a pleasure chatting with you.
Likewise. And to our listeners, thanks for joining us on this fascinating journey inside your mouth. Until next time, keep exploring the world around you and the fascinating world inside you.